the facial muscles and also spasms of the masseter muscles that cause the lockjaw or trismus. So that's absent in stiff person syndrome. But the other conditions can cause trismus.
4. The most common clinical type of tetanus is A. Local tetanus, B. Cryptogenic tetanus, C. Autogenic tetanus, and D. Generalized tetanus.
Okay. Any answer?
D.
Yeah, so D is correct. Generalized tetanus. He said it's the most common type. And in terms of the severity too, is the most severe form of tetanus.
5. Incubation period of tetanus is A. 5 to 8 weeks, B. 6 to 10 days, C. 3 to 21 days, D. 2 to 10 weeks. C.
3 to 21 days.
Okay, so 3 to 21 days. Any other answer? Or you all agree? Closer to the CNS compared to an injury on the leg. So proximity to the CNS affects the incubation period. All right, let's
6. The following can be used to manage autonomic dysfunction in tetanus except A. Morphine, B. Esmolol, C. Magnesium sulfate, D. Nifedipine. D.
Nifedipine.
Okay, nifedipine. Any other answer? So nifedipine is correct. All of them can be used, but the preferred one we said is max sulfate. So morphine can't use nifedipine.
Okay. 7. Tetanus is the only vaccine preventable disease which is non-communicable. A. True, B. False.
Okay, so what are you going for?
It's a true statement.
A.
Okay, so it's a true statement. He said it's the only vaccine preventable disease, which is infectious but not communicable. So that's a true statement. Okay.
8. Which of the following can neutralize bound tetanus toxin? A. Tetanus toxoid, B. Human tetanus immunoglobulin, C. Equine anti-tetanus serum, D. None of the above.
Okay, so what are we going for?
D.
Okay, I'm hearing D. Any other answer? Okay, so if you remember, we said for the tetanus plasma, which is the neurotoxin, we said once it gets to the nerves, it can bind to the nerves, and we have the ones that are free. So the bound tetanus plasma, you can't do anything about it. It will forever remain bound. Whereas the unbound form, that is where you can give drugs to neutralize the unbound form. So your human tetanus immunoglobulin or your ATS is there to neutralize the unbound form. However, the bound form, you can't do anything about it unless the body regenerates new nerves. That's how you would sort of overcome. But the tetanus specimen, which is bound, will forever remain bound. So none of the agents is able to neutralize. So it's none of the above.
Okay. 9. All the following are tetanus-prone wounds except A. Puncture wounds, B. Compound fractures, C. Burn wounds lasting less than 6 hours before skin graft, D. Dog bite wound.
Okay, so what are we going for?
C.
Okay, I'm hearing C. Any other answer? Okay. So remember, we've mentioned some examples of tetanus prone wound. Basically, what we said is any wound that is contaminated with soil, saliva, feces, or foreign material. That's a tetanus prone wound. If you have a puncture wound, usually the deep penetrating wound, someone stabs you with a knife, you have a gunshot wound, all these, you step on a nail, all these are puncture wounds or deep penetrating wounds. Then animal bites, because the animal bites are also associated with saliva contamination on the wound. These are tetanus prone. If you have a burns wound lasting more than 6 hours before skin graft, is also considered tetanus prone wound. And when you have compound fractures, you have a fracture, you can see that there's a wound. You can see the bones are penetrating, the tissues are out, and all that. That's a compound or open fracture. All these are tetanus prone. So the exception there is burns wound lasting less than 6 hours.
Okay. Number 10. All the following are goals of treatment in tetanus except A. Halting toxin production, B. Neutralizing bound toxins, C. Airway and supportive therapy, D. Managing dysautonomia. B.
Yeah, so neutralizing bound toxin is correct. You can't neutralize bound, you only neutralize unbound toxins.
11. How many doses of tetanus toxoid is said to confer a lifelong immunity? A. 10 doses, B. 3 doses, C. 5 doses, D. None of the above. C.
Okay, 5 doses. Do you all agree or any other answer?
Yes, please, we agree.
Yeah, so 5 doses. So even though we are saying tetanus doesn't confer natural immunity, but if you're able to get 5 doses of TT in your lifetime, it is said that you have a lifelong immunity. So that's how you are said to have been fully immunized. If you get 5 doses, lifelong immunity or fully immunized.
For the following questions, the following questions are either true or false. So number 12, ATS given to mothers provide fetal protection.
Okay, so is it a true statement or a false statement?
I think it's false.
Yeah, so it's a false statement. So ATS doesn't provide fetal protection. That's why for the mothers who are pregnant, you realize that they don't give them ATS. They rather give them TT because TT that will provide fetal protection. ATS doesn't provide. It's for passive immunization. TT is for active immunization. And it's short-lived, so it's not for a long period. TT, in terms of duration of immunity, is very long. So that's why we give it.
Okay. 13. Human tetanus immunoglobulin has a passive protection period of approximately 23 days.
Okay, true or false?
True.
Yeah, so that's a true statement. So the passive protection is just for 23 days. So you can imagine you need to give TT to provide an active immunity. You get it? So that's why for patients who are not immunized, you don't just give them ATS. You give them ATS and TT.
14. ATS is usually associated with anaphylactic reactions.
Okay, so true or false?
It's a true statement.
Yeah, so we said ATS is produced from horses. That's why we call it equine. So it's obtained from horses. While the human tetanus immunoglobulin is from humans. If we check all the major references, now they don't use ATS. They use human tetanus immunoglobulin because of the lesser risk of allergenicity. ATS, because it's from horses to humans, there's risk of allergic reactions. So that's why the shift is now to human tetanus immunoglobulin.
Okay, 15. Smaller doses of human tetanus immunoglobulin is required for treatments than ATS.
Okay. So is it a true or false statement?
True.
Yeah, so that's a true statement. So when you are treating tetanus with human tetanus immunoglobulin, even though those ranges 3,000 to 6,000 units start, but it's been shown that even the 500 unit start is enough to treat tetanus. Unlike ATS, where you do 50,000 unit day 1, day 2, 10,000 unit day 3, day 5, and day 8. So you need larger doses to treat compared to just a start dose of the human tetanus immunoglobulin.
Okay, 17. Clean wounds do not require tetanus immunoglobulin administration irrespective of immune history of patients. So sorry, 16. ATS and human TIG can be given together at the same site.
Okay, so is it a true or false statement?
Oh,
Yeah, so that's a false statement. In the first place, why would you give ATS and human tetanus immunoglobulin? They are basically doing the same thing, passive immunization. So if you do anything at all, it will be either ATS with TT or human tetanus immunoglobulin with TT. And this should be given at a different site, not at the same site because of the risk of being neutralized by the ATS or the human tetanus immunoglobulin.
Okay. 17. Clean wounds do not require tetanus immunoglobulin administration, irrespective of immune history of patients.
Okay, so what are you going for? Any ideas? What are you going for? Is anyone trying?
True.
False.
True.
Okay, I'm hearing true, I'm hearing false. Which is which?
It's a true statement.
There's a two statements. For clean wounds, remember last week I talked about clean wounds, tetanus prone wound, then someone who has no immunization, someone with incomplete, someone with complete primary immunization, someone who is fully immunized. Remember that for all the clean wounds, you don't give 8 years. You only give 8 years in tetanus prone wound because 8 years is supposed to neutralize unbound tetanus toxin. So if the wound is clean, it is said to be toxin free. So why give 8 years? Because the purpose is to neutralize the toxin. So if there's no toxin, what is there to give the 8 years for? So you only give TT depending on the immunization history. But for clean wound, irrespective whether it's primary immunization, never been immunized before, fully immunized, incomplete, you still don't give 8 years.
Okay. 18. Prophylactic dose of human TIG is increased to 500 units stat if the following except A. The wound involves a fracture. B. Patient weighs more than 90 kilograms. C. The injury occurred more than 6 hours. D. The wound is heavily contaminated.
Okay, so what are you going for?
D.
D.
What are you going for?
C.
Okay, I'm hearing C. Any other answer? All right, so the answer is okay. So the answer is C. So the prophylactic dose for the human tetanus immunoglobulin is 250. That's if you are preventing. So someone has developed tetanus prone wound. So you want to give human tetanus immunoglobulin to prevent. The dose is 250 units start, but it can be increased to 500 units if the patient weighs more than 90 kg, if the patient has a compound fracture, that is a wound, you have a fracture with an open wound. Then, if you also have a wound which is heavily contaminated, you need to increase the dose to 500. And if you have an injury lasting more than 24 hours, So an injury lasting for more than 24 hours without any intervention, that one we also increased to 500 units. So these are the recommendations.
19. Primary tetanus vaccination consists of A. 5 doses, B. 3 doses, C. 10 doses, D. 2 doses. B.
Yeah, so B, 3 doses.
20. A person who receives TT booster doses earlier than 10 years is most likely to have A. Type 2 hypersensitivity, B. Anaphylactic reaction, C. Athos hypersensitivity, D. Delayed hypersensitivity.
Okay, so what are you going for?
Arthur's hypersensitivity.
Yeah, so Arthur's hypersensitivity. So ideally, TT booster doses are given every 10 years. And if you receive it earlier than 10 years, you may develop a local reaction, which is Arthur's hypersensitivity. It's the same as type 3 hypersensitivity. So you may have some local reaction, some erythema, some itching. It's not really a big issue, but you have to know that the patient may have that reaction, which is known as the Arthur's hypersensitivity.
Okay, 21. Which of the following IM routes is not recommended for TT administration? A. Deltoid muscle, B. Gluteus muscle, C. Anterolateral thigh, and D. None of the above.
Gluteus muscle.
Yeah, so the gluteus muscle. Any reasons?
So you mentioned that it can cause sciatic nerve injury.
Exactly so. So the risk of sciatic nerve injury is high with the gluteal muscle. Because of that, you avoid the gluteal muscle. You can do the deltoid, you can do the anterolateral thigh, usually in children. But you try as much as possible to avoid the gluteal muscle.
22. Which of the following tetanus containing vaccines is recommended for children? Tdap, D tap, C TD, and then D DT.
Okay, so what are you going for? Okay, so looking at the options, whenever you see T, the T stands for tetanus. The D stands for diphtheria. And the P stands for pertussis. Then you can also see some A there. The A before the P stands for acellular pertussis. For the pertussis, we have two types. So we have acellular pertussis and we have whole pertussis. So when you want to give TT, at times you don't get TT as a standalone. You get TT combined with diphtheria and pertussis, or TT combined with diphtheria. So that's how it is. So for adults, usually we want to give the combination that has the D being small. Then for children, we want to give the combination that has the D, which is big. So we give the ones with small d to the adults, and we give the ones with the big D to the children. And the purpose is that when you see the big D means that it has higher concentration of the diphtheria component. The small d means that it has smaller concentration of the diphtheria. So for children, we want to give them higher doses of the diphtheria compared to adults who received based on the expanded program on immunization. You definitely receive diphtheria vaccine with pertussis and all that. So you have enough of them. So if you should get tetanus now and want to give TT, you rather want to give something that has a small d compared to children, which you can give the ones that has a lot of diphtheria component to provide immunity for them. So that's the differences. So let's answer this question. So which one are you going for?
D and D.
Yeah, so the B and D. So there are two answers here. So B and D. So that's true.
Twenty-three. Which of the following tetanus containing vaccines is recommended for adults?
A.
A.
Yeah, so A. So that's true.
24. Rationale for absorbing tetanus toxoids on aluminium hydroxide. A. To prevent degradation. B. To stabilize the toxoids. C. To increase its antigenicity. D. To make it hydrophilic.
Okay, so what are you going for?
To increase its antigenicity.
Yeah, so to increase its antigenicity. So basically, TT is tetanus plasmin that has been inactivated by formaldehyde. Once it's inactivated by formaldehyde, it's adsorbed onto aluminum hydroxide. And the purpose of adsorbing it onto the aluminum hydroxide is to increase its antigenicity, such that when you inject it, the body will be able to detect that this is foreign and then to start producing antibodies against it. So that's the purpose of the absorption onto the aluminum hydroxide.
25. ATS and TT are given together in patients with A. Missed booster doses. B. Fully immunized patients. C. Unknown immunization history with a clean wound. D. Unknown immunization history with a tetanus prone wound.
Okay, so what are you going for?
D.
Yeah, so that's true. Unknown immunization history with a tetanus from so D.
So use the key below to answer the following questions. So A is first statement is true, second statement is true, and is a correct explanation of the first. B is first statement is true, second statement is true, but not a correct explanation of the first. C, first statement is true, second statement is false. D, first statement is false, second statement is true. E, both statements are false. So 26, titanospasmin is a metalloprotease that is composed of light chain and heavy chains because the light chains is responding for its binding and entry into neuron, while the heavy chains are responsible for its toxic properties.
Okay. So what are you going for?
I think C.
Okay. Any other answer? All right. So the answer is C. So that titanospasmin, we said, is a metalloprotease. So when we say something is a metalloprotease, it means that it's dependent on a certain metal, so a certain metal for its catalytic effect. So titanospasmin depends on zinc. So it needs zinc to help with its action. That's why it's called a metalloprotease. And it's composed of two chains, light chains and heavy chains. So the first statement is true. And the second statement is false because the light chains are rather responsible for its toxic effect, whereas the heavy chains is what helps it to bind to the neurons. So the binding to the neurons is assisted by the heavy chains, whilst the neurotoxic effect is by the light chains. So it's a true false statement. So that's C.
27. Titanolysin is a neurotoxin produced by Clostridium tetani because titanolysin has been shown to cause hemolysis and cell damage.
Okay, so what are we going for?
Doc, I'll choose D.
Okay, I'm hearing D. Any other answer? Yeah, so D is correct. So titanolysin, the first statement, titanolysin is a neurotoxin produced by the Clostridium tetani. You said the Clostridium tetani produces two main toxins, titanospasmin and titanolysin. But the one that's a neurotoxic is the titanospasmin, whereas the titanolysin has no pathological role in tetanus. Just that we know that titanolysin is a hemolysin. It causes hemolysis. And it also has cytotoxic effects, so it can cause cell damage. But these are not seen in tetanus. So the first statement is false. Second statement is true. So that makes it D.
Okay, 28. Incubation period of tetanus is shorter in neonatal tetanus compared to generalized tetanus because neonates have a relatively shorter axonal length.
Okay, what are you going for? What are you going for? Is anyone trying?
Doc, maybe A.
Okay, so that's true related. I agree with you. Yeah, so the incubation period for neonatal tetanus is relatively shorter compared to generalized tetanus because neonates have a relatively shorter axonal length. So we said the incubation period depends on proximity to the CNS. So if you compare a neonate, we said for neonatal tetanus, they usually get exposure from cutting of the umbilical cord or improper hygiene at the umbilical cord region, leading to tetanus. So around their belly button, they should get the infection, the exposure there. From that place to the CNS is relatively short compared to someone with generalized tetanus, especially an adult who has stepped on a nail or had a cut or something. So in terms of transport along the nerves to the CNS, is shorter in neonate. And when you look at the axonal length, compare the size of a neonate to an adult. So for neonates, because of their relatively smaller size and relatively shorter axonal length, they tend to have a faster incubation period compared to an adult with generalized tetanus. So that's why it's a true statement, and both are related. Is that the last question?
Yes, please.
Okay. So that brings us to the end of the tetanus discussion. Do you have any questions based on what we've solved and any other tetanus question you want to ask? You can ask. Or anything you don't understand. So if you are okay with everything, that means once you get a case on tetanus, a question on tetanus, you should be able to answer. Since we've gone through everything and we've done some questions on them. In the absence of any questions, our next topic will be on rabies. So hopefully next week. So read on rabies is also one of the vaccine preventable diseases aside tetanus. So read on rabies so that the next time we meet, we'll have an interactive session on rabies. If there's no other question, we will end here. Have a good evening.
Thank you, Dr. Isha.
Thank you.
Dr. Ishak.
Thank
Bye.
you.
Okay, bye-bye.